Nursing 474, Public Health and Primary Healthcare Systems and Healthcare Transformation. The weekly learning objectives include describe specialization, public health nursing, and community health nursing and the practice goals of each. Number 2, identify clinical community health nursing practice with population-focused practice within your own community. Number 3, describe contributions made by early nursing leaders and their application in community health in the modern world. And number 4, discuss the core competencies of public health nurses. Although technologies, disasters, and global health crises influence the healthcare system, the ongoing indicators of cost, access, and quality continue to cause disparities in the United States healthcare system. As far as cost, the projected increase in spending for healthcare in the United States is 6.1% annually and is estimated to reach $4.5 trillion by 2019. The largest share of healthcare expenditures goes to pay hospital care and physician services, whereas the amount of expenditures for public health services is the lowest. Other drivers of increasingly high cost are prescription drug and chronic disease. Following the Great Recession, the economic rebound will coincide with burgeoning Medicare enrollment of the aging baby boomers. Medicaid enrollment will decline as jobs are added back into the economy, and the percentage of workers covered by employer-sponsored health insurance should increase to reflect that growth. However, costs will increase as employers pass on the increased cost of health care to their employees through premiums, co-pays, and deductibles. These increases may produce subsequent increases in the number of uninsured. As far as access, the U.S. Census Bureau reported that the number of uninsured rose to 46.3 million in 2008, driving increased public funding for those who lost private health care coverage. In the United States, medically underserved individuals, who include individuals and families whose insurance does not adequately cover their needed medical care, or those living in areas lacking adequate health care providers. The backbone of the safety net system for the uninsured and underinsured is more than the 6,600 federally funded public and nonprofit community health centers throughout the United States. The American Recovery and Reinvestment Act of 2009, an economic stimulus package, provided $2 billion in additional funding for the nation's community health centers to meet the increased demand. Additionally, some states increased funding, whereas others decreased funding to the regional community health centers. Major and systematic national health care reform to address both cost and access issues remained on the political agenda until the passage of the Affordable Care Act in 2010. As far as quality, in 1999, the Institute of Medicine reported that 98,000 deaths a year were attributed to preventable medical errors, launching concerns about the quality of health care in the United States. The Institute of Medicine estimated that approximately 7% of the deaths were caused by preventable medication errors. This raised questions regarding the nurse's role and effects of workloads on patient safety. A follow-up report, Transforming the Work Environment of Nurses in 2003, stated that nurses' long hours pose one of the most serious threats to client safety, calling for states to pass laws barring nurses from working more than 12 hours a day and 60 hours a week, even if by choice. Trends affecting the healthcare system. Because of national concerns for cost, accessibility, and quality of healthcare, significant change is expected in the next decade. Several trends will affect the way these changes evolve. The first one is demographics. The first demographic trend is the aging population. A second demographic trend is population diversity. The rise in the nation's foreign-born population is now 12.6% of the overall population. The third demographic is the changing healthcare workforce. Caring for a population that is aging, living longer, increasingly diverse requires a strong and flourishing workforce, yet the opposite is available today. The U.S. Bureau of Labor Statistics in 2004 projected that more than 1 million new and replacement nurses were needed by 2012. As far as technology, the development and refinement of new technologies such as telehealth have opened up new clinical opportunities for nurses, particularly in the management of chronic conditions, home care, rehabilitation, and long-term care. Telehealth is defined as the use of electronic communication networks to transmit client-related information used by the Department of Veteran Affairs to decrease hospitalization by 20% by improving home monitoring of chronically ill clients. The efficacy of telehealth has been studied with mixed results, and many safety and privacy issues remain. Medical technologies such as ultrasound, video assisted, and laser surgery, filmless radiology, robotic pharmacy dispensing, wireless monitoring, and virtual intensive care units have transformed hospital care for the sickest clients. This includes advanced technologies that have ensured client safety and improved quality. The electronic health record has been called the most important innovation for patient safety. The public health impact of such technology includes such potential advantages as 24-hour record availability, real-time assessments and test reports, interdisciplinary care facilitation, referral coordination, embedded guidelines at point of care and reminders, and improved record security. The personal health record is an electronically maintained record of an individual's health information managed by the individual with information from healthcare providers. The HIE, or Health Information Exchange, is the regional network of integrated data sharing, incorporating client information from local providers into one database, and will play a major role in the DHHS National Health Information Network. The recent outbreaks of severe acute respiratory syndrome in 2003, the avian influenza from 2004 to present, the H1N1 in 2009, as well as the resurgence of polio in Africa and Asia, and prevalence of human immunodeficiency virus and acquired immunodeficiency syndrome in Africa have encouraged a global view of health and wellness because disease can no longer be contained into one area of the world. Emerging infectious diseases have produced new demands for disease surveillance and transmission of accurate and timely information. The World Health Organization is uniquely positioned to coordinate prevention, detection, and response to public health emergencies at a global level. The organization of the healthcare system, although made up of many entities, can generally be described by settings and providers. The healthcare system can be classified into two components: private care and public health system, with the main difference being how they are financed. Most people receive care through private health care system, but the public system is an increasingly important safety net for the uninsured and underinsured needing health care and will play a major role in the future. The primary health care system, as a mainstay of the public health system in the United States, is defined as a broad range of services provided at the community level, including but not limited to basic health services, family planning, clean water supply, sanitation, immunization, and nutritional education programs. It's designed to be affordable for recipients and the governments that provide them. This is different from primary care provided in private healthcare system component, which is care provided to the individual at the first level of contact with the healthcare system. The National Health Plan, Healthy People 2020, under revision by the U.S. Department of Health and Human Services, identifies the disease prevention and health promotion objectives related to 38 areas of concerns and serves as a roadmap for the nation. The main goals are elimination of preventable disease, disability, injury, and premature death, achievement of health equity, elimination of health disparities, and creation of social and physical environments that will promote health and healthy development and behavior at every stage of life. They also include measurable health indicators. Primary care, developed in the 1960s, is the first level of our private healthcare system, delivered in a variety of settings with access largely dependent on geographical area and insurance coverage. During the cost containment initiatives of the 1980s and 1990s, many insurers, including the government, began to adopt the methodology of managed care. Managed care is defined as a system in which care is delivered by a specified network of providers who agree to comply with care approaches established through a case management process. The primary care workforce relies on the role of the generalist who possesses skills in health promotion and disease prevention, assessment and evaluation of symptoms and physical signs, management of acute and chronic medical conditions, and identification and appropriate referral for other healthcare services. Healthcare personnel trained as primary care generalists include family physicians, general internists, general pediatricians, nurse practitioners, clinical nurse specialists, physician's assistants, certified nurse midwives, and some physicians with special training in preventative medicine, public health, OB, and recently, doctors of nursing practice. Nearly 60 to 80% of primary and preventative care traditionally done by physicians can be done by NPs for less money. The public health system is mandated through laws that are developed at national, state, or local level. The federal system is composed of the United States Division of Health and Human Services, and it is headed by the Secretary for Health, and it is organized into 11 agencies. It is charged with regulating healthcare and overseeing the health status of Americans. There is a list of the different federal agencies. The Health Resources and Services Administration consists of 5 bureaus and directs grant programs that improve the nation's health and expand access to primary care for low-income and uninsured people, with emphasis on maternal child health, HIV and AIDS, rural populations, medically underserved areas, and populations with special needs. A component of this agency is the Bureau of Health Professions, including separate divisions for nursing, medicine, dentistry, public health, and allied health. These provide competence and expertise for administering professional education, interpret trends, and maintain liaison with the professional community and international, state, regional, and local health interests. The state system provides a wide array of services, including healthcare financing, mental health and professional education, establishment of health codes, licensing of facilities and personnel, regulation of the insurance industry, and readiness for disaster prevention or response. States also have a substantial role in direct assistance to local health departments, and especially in the area of health needs assessment. States have control over the boards of examiners of nurses, which generally have a responsibility for licensing and examination of RNs and licensed practical nurses, approval of schools of nursing, suspension or denial of licenses, and writing of regulations about nursing practice and education. The local system has direct responsibility to the citizens in its community or jurisdictions. Services and programs offered by local health departments vary greatly depending on the state and local health codes that must be followed, the needs of the community, and available funding and other resources. In conclusion, public health nursing is defined as the practice of protecting and promoting the health of populations using knowledge from nursing, social, and public health services. Nurses make up the largest portion of the public health nurse workforce, primarily at local level, where state and local health departments have increasingly focused on emergency preparedness and response since the tragedy of September 11, 2001. Whether change is transformative or evolutionary, nurses will be poised to play an active role in reconfiguring the system.